It started as a slight tingling in her thumb and ended with dropping coffee mugs and waking up in pain every night. She was 47, an accountant, healthy, a jogger, but pain and weakness in her right hand and arm were wrecking her work and her sleep. Doctors talked about surgery, but what if the real answer wasn't in the OR, but in how she sat, worked, and moved? This is the powerful story of how physical therapy uncovered the root cause of her pain, rewired her nervous system, and helped her avoid the knife. Jen, a 47-year-old accountant, had been healthy most of her life, but 4 months ago, her right arm started tingling. A burning feeling crept into her forearm, her thumb, then her palm. 2 months later, she was waking up in pain after just an hour of sleep. And when she began dropping things, that's when she sought medical help. The X-rays showed wear and tear at her neck. Electromyogram test showed nerve involvement. The diagnosis: cervical radiculopathy, likely at C6, that is cervical vertebra level 6, and maybe even carpal tunnel syndrome. The physio evaluation. When Jane walked into the physio clinic, one thing stood out immediately: her posture. Forward head, rounded shoulders, tight trapezius, internally rotated arms. These were not just cosmetic issues, they were signs of dysfunction. She had tenderness at C5 to C7, limited motion in her neck, reproduction of symptoms during nerve tension tests, and weakness in the thumb muscles, a sign of nerve compromise. The real cause, not just the neck. Her therapist understood that this was not just a disc problem. Jane's pain came from multiple sources: years of poor posture, limited cervical mobility, more tightness, and nerve compression. Her symptoms were classic for cervical vertebra 6 radiculopathy with secondary carpal tunnel signs. But here is the twist: it wasn't just what was happening inside her spine, it was what was happening outside her spine that kept aggravating the nerves. The treatment plan: function over fixation. Here is what the therapist did and did not do. No immediate spinal manipulation, and there was conservative, structured care. The initial physio plan: cervical traction of 5 pounds for decompression, Maitland grade 1 mobilizations. Maitland grade 1 mobilizations, that is gentle targeted movements at the C5 to C7. Postural education on sitting, sleeping, and walking. Soft tissue manipulation or mobilizations, releasing the scalene, the sternocleidomastoids, and the upper trapezius muscles. Modified Mackenzie exercises, that is chin tucks and dorsal glides. Forearm strengthening and median nerve stretching. Every piece had a purpose. Every move protected the nerve and trained her body to stop provoking it. Ergonomics, the secret weapon. Jen's therapist knew 1 hour of therapy means nothing if 8 hours of desk work keep undoing it. So they rebuilt a workstation, monitor at eye level, ergonomic keyboard, elbow supports, regular stretch breaks, and strict posture correction. They even simulated her office at the clinic, and she had to identify and correct her own postural faults. This wasn't just therapy, it was training. The results, measurable wins. In just 6 weeks, Jen had made serious progress. Cervical flexion improved to 60% of normal flexion. Forearm symptoms reduced. Scapular and neck mobility returned. Thinner muscles weakness improved slightly, still at power 4 out of 5. Then ergonomic habits were locked in. But traction had a catch. At first it helped, then symptoms worsened after treatment. So the physio adjusted, less force, shorter duration, and symptoms stayed down. The long-term outlook, avoiding the knife. Jane was a candidate for surgery, a spinal decompression or fusion, but it was held off thanks to steady gains. Her goals by discharge: full cervical range of motion, minimize symptoms in the arm, knowledge of workplace ergonomics, prevention strategies in place. She continued her home program, checked in every 3 months, and kept improving without needing surgical intervention. The lessons you need to hear. This case teaches us something crucial. The key takeaways: nerve pains. Nerve pain doesn't always require surgery. Sometimes posture is the pressure. Pain in the hand doesn't always come from the hand. Trace it back. Ergonomics are not optional, they are life-changing. Conservative care done right works. If you have unexplained hand tingling, arm pain, or weakness, don't wait. Get assessed and don't just treat symptoms. Treat the system. And if you are a clinician, listen beyond the pain. Train beyond the table. Thanks for watching another real life recovery story from hashtag Dr. Wilberforce Physio. Comment below what's your biggest workplace pain. Subscribe for more physio case breakdowns that empower patients and professionals. Support this channel via Patreon link or PayPal link to help us spread recovery stories that matter. Thank you.